couple key movements that we often see are limited that kind of feed into the lower back and cause lower back pain are shoulder flexion. So if we're going overhead, we actually run out of room in shoulder flexion, so we rob that from our lower back. That's why we often see lower back pain in overhead athletes. Another really important one for our other athletes is with running is that if we lack hip extension, pure hip extension from the hip and down, if we lack that, a lot of times we feed forward into our lower back. So what we see is that people that have limited shoulder flexion or limited hip extension, a lot of times that feeds into the lower back. Let me show you what I mean and how we test for hip extension and how we can determine if that's maybe causing your lower back. The relationship between hip extension and lower back pain, we want to assess in lying at first. It's the easiest position. So what we can do is we can just have the patient lie on the table and then we ask them to lift their leg up off the table. They should be able to lift their leg up close to a 30 to 45 degree angle without feeling it in their lower back. If they lift and we kind of get this little bit of a roll and we see the muscles of the lower back tightening or creating tension, then we can be sure that it's feeding too much force into the lower back. And then a good exercise for that, exercise to kind of train the brain and train the body to isolate hip extension and not rob it from the lower back, is you actually lay over an edge and you block your lower back, and then you can lift your hip up and isolate pure hip extension and down. So we can shorten the lever by bending our knee to start to train that. We can add resistance if we want through resistance bands, and then we can work in to straight hip extension, kind of feeling our glutes contract, and we shouldn't feel too much action into that lower back. Relationship in assessing an athlete and their ability to raise their arm overhead without robbing that from their lower back, we can actually have them go over to the wall. So either they do a little bit of a quarter squat, and what they want to focus on is they can take their offhand that we're not testing and focus on keeping that rib cage down and the spine pushed into the wall. And then we ask them to raise their arm overhead and see if they can get their thumb back to the wall without cheating it and kind of arching through the lower back. So if you look at it a little bit closer, it looks like this. Are they able to do it without robbing it from their lower back? With this compensation, they have to keep their pelvis neutral, come back up and back down. So we can kind of groove that pattern of overhead mobility, pure shoulder flexion, and keep that. We also want to note their head should be able to stay against the wall too, because a lot of times people will do that as they come up. Those are two great ways to assess shoulder flexion and hip extension in the relationship with lower back pain.